Hello everyone, I welcome you back to the channel. Today we have with us a very special guest who is not only an inspiration for just medicos but also in general population. Today we have with us Dr. Manan Vora sir, who is a full-time orthopedic surgeon and also specializes in sports medicine. And that is his expertise because I have seen that he himself is a very great, sports enthusiast. So today it's a very pleasure for us to have you on the show, sir. I welcome you in the show.
Thank you so much, Aksha. Thanks for having me, and I'm happy to share my experiences in this chat. So looking forward to it.
Right. Thank you so much, sir. So, as you all must be knowing that sir is practicing currently in Mumbai. And if you have been following him on Instagram, you must see that sir is very active, not only in his practice, but also he creates some awareness video for general population. And I think you must have also taken some of his quizzes about, anatomy and general body. So I think today we will ask some of the more questions to sir that not only relates to his medical career, but also relates to general life, like how he has faced some challenges and he is at that particular position. So if it's okay, sir, we can begin with the question round. Our audience would like to know more about you.
Absolutely. Looking forward to it. Let's go.
Yes, sir. Okay, sir. So sure. So, sir, as you know, it is common concept that people think usually that MBBS is a non-creative field, like that, like you are a sports enthusiast person, and your sports medicine is definitely, an inspiration and breakthrough to it. So, how do you, stay motivated? How do you challenge yourself to do something unique, and also at the same time, practice it in the best possible way?
So, personally for me, it wasn't something that I had, planned always. So I have been, an athlete throughout my life, right? From मेरे school के time से लेके मेरे college के time पे, I have, played cricket, football, lawn tennis, even at state and national level. तो sports मेरे लिए बहुत ही, naturally मेरे life में imbibe हो चुका था. And, when I ended up taking a decision कि मुझे आगे sports में जाना है या medicine में करना है. Now I come from a complete medical background. My parents, grandparents, everyone is into medicine. So वही surrounding में मैं मेरा I have grown up and I have been used to it, and it was a very natural progression for me कि science लेना है, उसके बाद medicine करना है. So, being a sportsman is obviously not easy. Not everyone makes it. Not everyone is successful. So for a more, secure situation, it is something that, I picked. Abhi, obviously, मैंने sports खेलना छोड़ा नहीं as a recreational athlete, whether it was, representing my medical college or, festivals में खेलना, दूसरे colleges के festivals में जाके खेलना. I remember even going to Delhi for AIMS's festival Pulse and, representing my college over there. So I have always been into sport. And then, for me, it was a motivation in terms of staying attached to sports in some way or the other, and that's where orthopedic comes in, because obviously, as you all know, orthopedic is more to do with the back and the limbs and injuries that come with sports and all of that. So for me, it was a very natural progression to go into ortho. And uske baad mujhe sports medicine ka actually exposure mila ki from orthopedics you can go into the sports medicine side of things. You can work with teams, you can actually work with athletes actively. So, it was a very beautiful journey for me to find a way to amalgamate my love for sports and my love for medicine, and in this case, my specialty, which is orthopedics. So that is where the entire sports orthopedics or sports medicine aspect came in. So it's a little unconventional and it is unique, I must say, because even though there are MCI recognized sports medicine post graduation programs, very honestly मुझे ये बात पता भी नहीं थी actually when I was doing internship and preparing for NEET. So it was something I did not even know. Now the awareness is little more of all these other branches, but I chose to approach it from the orthopedic side of things, and that has been very helpful for me, and it's worked out very well for me. So let's see where it goes ahead.
Right, right. So that's a very great, message for everyone. Like all the MBBS students who are currently watching it, all of you must be having some hobbies, right? Like from maybe sketching, maybe whatever in the sport area. You should always, try a way to balance it and also continue it, even if your profession is way different. But it's not like that you can't take out time for the things which keep you alive. So it's a very great message for our audience. And sir, regarding the sports medicine branch, I have also seen that you are as you go as a doctor with the teams like football teams and other teams. So on that aspect, how would you rate the branch, and also tell about the opportunities, the perks for our audience? Because at this stage, if someone थिंग्स कि यार 6 महीने बढ़िया होटल में अगर लॉकडाउन के टाइम अगर आप जैसे टीम के साथ गए तो होटल का सारा एक जो लिविंग एक्सपीरियंस रहता है और टीम्स के साथ रहना, तो वो एक काफी लीजर वाला साइड आ जाता है जो यूजुअली डॉक्टर लाइफ से काफी डिफरेंट होता है, बिकॉज वार्ड्स में हम 24 घंटे लगे रहते हैं. तो हाउ वुड कंपेयर इट विद दैट कन्वेंशनल ट्रेनिंग?
सो फर्स्टली तो वो जो 6 महीने का होटल में जो हम रुके ना, उसके बाद आई वाज लाइक desperate to go home. I did not want to spend a single day. उसके बाद मैंने 6 महीना एक होटल में मैं रहा ही नहीं, even for one night stays or anything, nothing. I was like, मुझे होटल का खाना नहीं खाना है, मुझे होटल में रहना नहीं है. So ऐसा situation होता है that sometimes the grass is always greener on the other side, and you feel that others are always having it easier than you. But that is not always the case. Starting में बहुत fancy लगता है, होटल में रहेंगे 6 महीना ये करेंगे, but it is not ideal. And plus, when I did it with Punjab Football Club, we had the COVID bio bubble. So we had a lot of restrictions. We had every 3 days RT-PCR. So uske saath kafi lot of problems and issues that were also there, which wasn't really making it as pleasant a stay as people may think from outside. Coming back to your question, since obviously our target audience is MBBS students who must be wondering, yaar, ye sports medicine hai kya? What is the scope? What are the opportunities? What are the branches? What exactly happens? So I'd like to explain the situation, at least how it is in India, because it is very different abroad. So we need to understand that in India, actually, orthopedics are using the term sports medicine very differently. When someone does arthroscopic surgery for mainly knee and shoulder injuries, जैसे कि आपका rotator cuff repair जो arthroscopically होता है, या आपका ACL tear जो arthroscopically होता है, India में orthopedics are using the word sports medicine for that. So when you see general orthopedics who are doing arthroscopic surgeries, जब वो sports medicine का term use कर रहे हैं, they are saying that they are arthroscopic surgeons. Now abroad, they are called sports surgeons. They are not called sports medicine specialists. Whereas sports medicine specialists, they look after different aspects related to the medical and exercise side of sports injuries or sportsmen or athletes. So that is the first thing you need to understand, that in India, sports medicine is used very commonly by arthroscopy specialists. It's not wrong, but ideally they should be saying sports surgery instead of sports medicine. So that's the first thing. Secondly, there are two ways to go about it. One is either you do orthopedics and then you go into sports injury management, which can be obviously done conservatively also. They can be done in the form of interventional techniques. They can be done in the form of surgery. These are the three options that you have. Or you can do an MD or a diploma in sports medicine, which is offered, I think, in SRMC Chennai, AFMC Pune. Diplomas are there in your Patiala, National Institute of Sport, Patiala. So there are 3-4 institutes. Safdarjung in Delhi has sports medicine. So these are the various institutes that are offering sports medicine. But here you need to understand that that branch is basically dealing with being a medical doctor for an athlete.
Right.
So technically, their entire focus, if you do a post-graduation in sports medicine, you are not just dealing with injuries. In fact, you are dealing with just the basics of injuries. क्योंकि जब भी actually injury होगा थोड़ा भी detail में, तो directly orthopedic के बाद आपको भी भेजना पड़ेगा.
Right.
It is just basically first aid management on the field or something that you can give. Your majority of your work will be basically doing an MD medicine, but you are treating athletes. So that is sports medicine.
Right.
So you have to basically look after their dermat problems, their gastro problems, their all internal medicine problems. You have to know about ECGs and cardio problems in athletes, which is something which young athletes also face, cardiac issues. You will have to dip into their exercise. You will have to coordinate with the physiotherapist and look after their rehabilitation program. You will have to coordinate with a psychologist and look after their sports psychology. You will have to coordinate with a nutritionist and look after the nutrition part of the athlete. So it is a completely different branch, जिसमें your entire career will be devoted to either traveling with a team or working with, like an Inspire Institute of Sport in Hyderabad, or these massive academies which have now gotten formed in the country, and they are being run by charity organizations or philanthropic individuals who have donated money for developing sport in India. You will be working in such places. You will not really be working in a hospital setup. Yes, I do know of some orthopedic people who have managed to set up a sports medicine department in private hospitals also. So aisa nahi hai ki there is no possibility in a hospital, but you have to be prepared ki overall aapka life is going to be on the field or with academies and directly dealing with sportsmen. Whereas if you do ortho, then you have the option of working as a sports medicine expert whom these sports medicine people will send from the academy, or teams will send directly to you in the hospital for an expert opinion. Or you can go into arthroscopy then and then repair all the ligaments, tendons and all of that. Or you can do interventional techniques, which is something which I am planning to specialize in the form of steroid injections, PRP injections, which go into regenerative medicine and help healing of tissues, which is what I'm planning to do and I'm already doing. So there are various options for an ortho to go into sports medicine, but work from the hospital or clinic setup, or you can go into the sports medicine PG, and then you have to know that majority you will be working with teams. So what I'm trying to do is strike a balance and work 20 to 30% of my time with teams and with athletes, but the rest of the time I'm treating general population and doing orthopedic work itself. So this is the broad understanding that someone in their MBBS or internship needs to have. Don't just see ki PG mein kya karna hai, because obviously getting a sports medicine. So actually it's not that getting a sports medicine seat is easier than getting an ortho seat, very honestly, क्योंकि sports medicine की seats बहुत कम है, whereas ortho की seats इतनी ज्यादा है. Of course आपको बहुत पीछे वाले रैंक में भी डिप्लोमा स्पोर्ट्स मेडिसिन तो पटियाला में मिल ही जाएगा, ऐसा नहीं है. बट you need to keep in mind that you have to see कि मुझे 5 साल बाद क्या करना है. मुझे हॉस्पिटल और ओटी में काम करना है और खुद का क्लिनिक या सेटअप चाहिए, या मुझे टीम या अकेडमी, एंड यूजुअली ट्रैवलिंग अवे फ्रॉम होम, बिकॉज ऑब्वियसली विद अ टीम एंड विद एथलीट्स you'll be traveling, with academies you'll be staying with an academy. So it's a very different lifestyle that you have to understand and what you want to do, and then decide कि आपको पीजी में क्या करना है. ऐसा नहीं कि आपने पीजी ले लिया फिर आप सोच रहे हो अभी यार अभी मेरा लाइफ ऐसा हो जाएगा. So you have to understand these two things. So I think that is the brief summary की sports medicine is what, and then ortho करके then going into sports medicine what, and sports surgery and arthroscopy वो completely अलग है. So I hope that has solved some understanding.
Right. Definitely, sir. Definitely. So it's, a very perfect balance that sir has maintained right from his practice to his passion, and he's doing exceptionally well. So now on the same note, sir, that already the audience that is watching is MBBS, they are thinking, yaar, MBBS itna tough hai, right? Now, even if you go in any branch, not only medicine, surgery, her branch mein there are fine specialization, which will make you away from the crowd, right? Which will make you stand apart. Like you are saying that you want to master more into that steroid injection and all that. So what would be your advice to, upcoming future of doctors, that they should not only saturate with the specialization, but understand its importance and how to stand apart from the crowd?
So, the thing is, we are reaching now in a position where specialization is being considered कि हाँ ठीक है specialist तो है ही, पर आगे क्या किया आपने?
Right.
Now, personally, I know it's a little ironic कि I am giving this advice because I have done specialization and I'm not done a super specialization degree because ortho is an end branch in that sense. But in terms of fellowships or skills, obviously you can keep upgrading yourself. But the thing is, we are reaching a point where everyone wants to be a specialist. I don't know who is going to be a generalist. So when I say generalist, I am not talking कि MBBS करो और फिर आप GP बन जाओ या फैमिली डॉक्टर बन जाओ, यही करना है, इसी का मतलब जनरल डॉक्टर होता है. I mean, we are reaching a point कि अगर कोई बंदा समझो ऑर्थो करे या ऑफ्थाइल करेगा या ENT करेगा या जनरल सर्जरी करेगा, even stopping over there is also, it's like you are a general orthopedic doctor. मतलब simple back pain, knee pain, shoulder pain के लिए मैं आपके पास आ सकता हूँ या नहीं, या आपने इतना super specialization कर लिया है by calling yourself a foot and ankle surgeon or a hand surgeon, that only you are seeing patients from here to here, even though you have almost done your ortho and your super specialization. So what I will say is that while it sounds fancy, and obviously there are certain doctors in every city that have reached that super specialization milestone and they are famous for it and they are known for it and they are doing well in life, it is not a bad thing by any means to do PG and stop over there and see general patients of your branch. It's also not a bad thing to stop at MBBS and see general patients in general, but it's very okay to stop. In fact, I personally definitely believe that I want to be a general orthopedic with some extra skills in terms of the injection techniques and all that I want to do. Because I don't, aisa nahi hai ki if tomorrow if a patient comes with even a trigger finger, I want to see them. And even if he comes with a neuroma in his foot, I want to see him. ऐसा नहीं है कि I want to market myself or project myself as an expert in one thing.
Right.
Okay, so agreed. See, it's not that I don't have ambition or people should not have ambition. Everyone wants to be the best in that. But अभी ऑफ्थाल करोगे तो यार एकदम कॉर्निया का स्पेशलिस्ट बन के उसमें बेस्ट बनना बहुत मुश्किल भी है और बहुत बड़ी बात भी है. तो अगर कोई बन जाता है तो इट इज एक्सीलेंट, इट्स नॉट अ बैड थिंग. But there is nothing wrong that in stopping at a particular point and being a good general doctor that everyone trusts and everyone comes to, because you can genuinely build a very successful practice by being a general doctor in your particular field.
Right.
So there is absolutely no need to have that craze ki mujhe ye and then keep, because the more niche you go in, the narrow you make your patient base. Because if you are going to tell everyone that you are just a shoulder surgeon or you are just a particular type of ear surgeon instead of being ENT in general,
Right.
so you are limiting your patient base more and more. And unless you reach the top of that branch where everyone else is sending patients to you because they know you are famous in that one thing, if you
Right.
reach that, it's great. But if you don't, then you're going to slowly go back to a general practice, which is always difficult to do when you've already marketed yourself and you've studied and done fellowships and gone into that aspect. Because abhi ortho mein bhi dekho, agar koi शोल्डर स्कोपी में उसको बस वही करना है लाइफ में, तो 2-3 साल he'll work with senior arthroscopic surgeons, he'll do fellowships abroad, and then he's not done everything else apart from shoulder for the last 2-3 years. So then to go back is very very tough.
Right.
So my advice would be कि करो पीजी. ऑब्वियसली अगर नहीं कर सकते हो तो भी ठीक है, लेकिन अगर आप करो पीजी तो उसमें भी आप जनरल डॉक्टर बन के बहुत अच्छा काम कर सकते हो. ऐसे कोई जरूरत नहीं है कि यू हैव टू कीप चेजिंग हायर एंड हायर.
Right, right. So it's very important to, introspect at whatever point you are. If you are an MBBS student, finish your MBBS, then look forward. If you are a postgraduate, finish it and then look forward. So that's perfect advice, sir. Now also, you are very great at dance, and I have, seen all your reels as well as your stuff on the Instagram, as well as the awareness posts that you create for, nutrition and for general diet as well. So how do you manage all these stuff? Because like I am also, I face sometimes problem कि मैं पढ़ रहा हूँ पर मेरे दिमाग में ये आ रहा है कि मुझे कंटेंट बनाना है यूट्यूब का, राइट. इट्स समटाइम्स ऐसा मुश्किल हो जाता है कि आप जिस चीज पे कर रहे हो आपको लगता है क्या वो बैलेंस हो पा रहा है. सो ऑल्सो फॉर मी एज वेल एज फॉर ऑडियंस, प्लीज लेट अस नो दैट हाउ डू यू मैनेज ऑल दिस स्टफ.
यार ऑनेस्टली आई शुड आस्क यू दिस क्वेश्चन, क्योंकि अगर तुम वो स्टेज पे टाइम निकाल रहे हो करने का, वो बहुत बड़ी बात है. बिकॉज आई थिंक एज द सीनियर यू बिकम ऑब्वियसली जो आई डोंट नो इफ आई शुड यूज द वर्ड कचरा काम, बट जो कचरा काम होता है वो कम हो जाता है. बिकॉज ऑब्वियसली देयर आर जूनियर्स हु आर डूइंग दैट. सो एज यू गो हायर अप द लैडर, राइट फ्रॉम internship to first year residency, and then once you finish residency and go higher, new and new people are coming in and वो कचरा काम कर रहे हैं. तो obviously थोड़ा ज्यादा time मिल रहा है. More than that, I am already in private practice, working in a private hospital with a senior ortho over there. So in general, private hospitals will have lesser of the work which people have to do compared to the government hospitals and things like that. There are more sisters, there's a better staff and things like that. So जो भी फाइल वर्क रहता है या द इंटर्न जॉब रहता है, all that is not there. So there's definitely more time in that sense compared to someone who is an intern or someone who is in first year residency and things like that. So I do have more time, yes. But yeah, I mean, it is something that I am enjoying the process. I think if you're enjoying the process, it makes it much simpler. It shouldn't seem like यार आज मुझे ये वीडियो शूट करना है क्योंकि मैंने बोला है कि यार मैंने करना है. So as long as the process is enjoyable and you're just being yourself, I think that makes the process very easy. When it comes to things like dance and all, it is just something for fun, I mean, the platform is such like that. I mean, for example, it is now I am on Instagram, so it's something that is a platform where you can do like that. Now I would never post that same dance on my Facebook. I would not, if I had a YouTube channel, I would not put that dance on YouTube. So Instagram, I feel, is more about showing yourself, showing your personality, showing what you do during the day. Just if you're happy and you feel like doing it, you do it. So I feel it, if it comes naturally, it's okay, but it's definitely not part of my content strategy or something that I can do very often and all of that. So yeah, I just like to be natural about it. That's it.
Right. So ultimately, not only as a creator, but whatever you do, you must enjoy that process so that you can have that peace of mind. Ki whatever I am doing, I can give my best in that, and also I can deliver it for the audience. So that's
Absolutely.
absolutely correct, sir. Now, also, that like you are doing some very unconventional works. Also, you are balancing your life. There are people, who try to demotivate you. People will demotivate you even if you do normal work also, but in some kind, when you are doing something very unique as compared to the mass, it becomes very difficult because there are a lot of people who are just waiting for that one spot to hit on, for the hate or whatever reasons they can try to demotivate you. So have you faced either any some circumstances, or how you manage it? Because day to day hate is a really big stop for everyone, because it disrupts your entire ecosystem.
No, no, I personally have had that because I don't know if you have heard of anyone who has done this before, but I went for a fellowship in the middle of my orthopedic residency.
Okay.
So I there was a sports medicine fellowship, जिसका criteria था anyone with MBBS with an interest in sports medicine can apply for it.
Okay.
So the criteria was not that you have to have finished any sports medicine post graduation. The criteria was not that you could have finished, you had to have finished any orthopedic residency. Now, this fellowship was being offered by a doctor in Mohali, an orthopedic surgeon in Mohali, in tie-up with Abhinav Bindra's Sports Medicine Institute. So it was really being marketed everywhere because Abhinav Bindra's name was attached to it. Now, I applied for it thinking, यार ऐसे ही apply करने में क्या है? There's nothing I lose in applying for it. And there were 3 levels of interviews, and ultimately I got selected. Only one person got selected. Now it was such a big thing and I didn't know what to do, so I discussed at home that what's happening and all, and then I spoke to my unit head in my department. And obviously the first reaction was that ये क्या होता है, मतलब पीजी के टाइम पे कोई छुट्टी कैसे ले सकता है, या पीजी के टाइम पे कोई ब्रेक कैसे ले सकता है, पीजी के टाइम पे तू स्पोर्ट्स मेडिसिन का फेलोशिप कैसे करेगा. नाउ सी व्हेन दे हर्ड स्पोर्ट्स मेडिसिन दे थॉट आर्थ्रोस्कोपी. सो दे आर थिंकिंग कि यार तू अपने फर्स्ट, माय फर्स्ट ईयर वाज जस्ट एंडिंग, सो दे आर लाइक अब तो तू, यार फर्स्ट ईयर में हम लोग क्या करते हैं यार, प्लास्टर लगाते हैं और बेसिक इम्प्लांट रिमूवल केसेस करते हैं, ऐसा सब होता है. इट्स नॉट लाइक यू आर डूइंग टीकेआरस और एनीथिंग लाइक दैट. You are definitely not getting anywhere near arthroscopy in your first year of residency. Very unlikely, because second and third years or the lecturers want to do it. So they are thinking तू वहां जाके क्या करेगा, तूने तो यहाँ भी नहीं स्कोप पकड़ा है. But they were not able to understand only कि मैं किसके लिए जा रहा हूँ, मैं क्या कर रहा हूँ. This is not sports surgery. So I got so much of negativity from them, but ultimately I made the decision, and I went to the dean and I got my leave sanctioned. My HOD said, okay, you can go as long as you come back and do those months later on. You'll miss that exam attempt, and I was ready to do that. So I went and I took a 6-month break. I went to Mohali and I did that. People were wondering, where is this person gone? What has happened? How can you leave residency in the middle? And then I came back. I finished my residency. All of that done. And in those 6 months, I actually learned so much कि यार interventional sports medicine करके कुछ होता है. There is something called interventional techniques. Like you guys will still not know about it because it's still not being spoken about so much. Over there मेरा network बना. I met more people in the sports medicine world. Eventually, after I finished my ortho, I got a chance to spend 3 months in Bangalore with a sports radiologist. Now, have you ever heard an orthopedic going and doing a fellowship under a radiologist? Again, when people heard that, they were like, "Ye kya ho raha hai? Is this normal?" The radiology community got to know about it. That why is a radiologist teaching an orthopedic what we do? Because the reason why I'm saying radiology is because a sports radiologist abroad, and this sir who I did my fellowship under, who is now my mentor and guide, he basically does interventional procedures in muscles and joints under ultrasound guidance. That's where a radiologist comes in, because wo sonography machine mein dekh ke he is doing interventional procedures. Which is something an orthopedic doesn't do, because an orthopedic doesn't know how to use the ultrasound machine. An orthopedic is directly giving blind injections and hoping that it's going to the targeted area. So I did a fellowship over there, and then after that also it was like, what is he doing? He's an orthopedic. Why is he not in the OT? ये radiology के department में क्या कर रहा है? So it is still a very, very new concept. And the reason I am in private practice is because the path that I have chosen, which I like to call, and what USA calls it, is interventional orthopedics. It is completely unconventional and unique. There is no interventional orthopedic fellowship in the country, but in US there are interventional orthopedic fellowships. Is basically the targeted delivery of drugs or blood components in the case of PRP, or stem cells, which is done under ultrasound or CM guidance. CM machine, I'm sure many MBBS people know what a CM machine is. I'm sure what orthopedics use very commonly in the OT for, reduction and all of that. You just do a quick CM scan. So under that guidance, you are seeing exactly where you want to inject, and you are injecting rather than giving blind injection. So that is basically interventional orthopedics, is what USA calls it. If radiologists do it, they call it interventional radiology. If anesthetists have now started doing super specialization in pain medicine, I don't know how many of you are aware of it, but wo jo pain medicine mein kar rahe, to pain medicine also people are doing it, but orthopedics are genuinely not doing it. So I am in such a spot actually currently, and now what I've gotten used to is because I don't fit into the orthopedic department of an institute, I don't fit into the radiology department of an institute, and I don't fit into the anesthesia department of an institute. So I have basically understood that I am on my own in this journey, and there will be people who are skeptical. There will be people who will pass comments, and I have faced that from the orthopedic community because they are wondering what I'm doing. I have faced that from the radiology community because they are pissed off that an orthopedic is learning how to use the ultrasound machine, because they feel only they should be the ones using an ultrasound machine.
Right.
And I don't fit into an anesthesia department because I don't have an anesthesia post graduation. So I can't even join a pain department of a hospital, which are anyway very few because it's a very upcoming super specialization branch. Like only the major corporate hospitals have a pain medicine department now, but that is run by anesthetists. So I don't fit into any department. I have to establish myself privately in a clinic. I can obviously use a hospital for procedures which require CM, and it's something that I have gotten used to ki baatein chalti rahegi, and I have to figure out the path on my own. So it is just something that I have gotten used to.
Great. Perfect, sir. So I guess इससे अच्छा कोई answer हो नहीं सकता based on his real life, that at every step he has challenged someone at their own path, that see, I can do better, I can take a different path. And as
I wouldn't say I can do better. That time will tell, but I can do something differently, and it's okay to think out of the box and do it. Whether I can do it better, and whether this path has worked or not, maybe 5 years later I'll be able to answer you. But yeah, I'm hopeful. So let's see.
Sure, sir. We will have you on the same podcast after 5 years also. So that's not an issue, right? So now at the end, I want to keep you in a situation that, like, you are currently Dr. Manan Vora. Right now you are in your MBBS first year or second year, suppose, and now you see down the line, what are, say, one advice, two advice that you want to, golden statement which you want to give to MBBS students, so that they can take out this from this video and they can remember it in their entire practice.
So the couple of things that I would like to say. Firstly, I would like to address something which is happening very differently now than it was in my time. In my time, studying for PG before internship was not a concept. मतलब जब हम फर्स्ट ईयर में थे, सेकंड ईयर में थे, थर्ड ईयर में थे, फाइनल ईयर में थे, there was no Bhatia Dams prep ladder classes for second year, third year, fourth year students. For interns, yes, the moment you start internship, there were people enrolling for the classes and doing 10 hours on weekends and all that thing. That is okay. तो ये तो मतलब अलग ही कंसेप्ट चल रहा है आजकल की, आई थिंक फ्रॉम सेकंड ईयर, और व्हाट पीपल आर स्टार्टिंग, आई डोंट नो,
फर्स्ट ईयर से स्टार्ट हो गया सर आजकल तो.
दैट इज क्रेजी. So I don't know if I am the right person to give advice, because I'm not giving NEET today. I gave it 3-4 years back. So I'm not the right person to give advice on this. But what I would like to say is कि यार ये PG preparation के चक्कर में don't miss out on your MBBS fun. That is the first thing. Because very honestly, when you enter MBBS, you think, oh my God, I've entered medical college. This is going to be the toughest phase of my life. And also because all your non-medical friends are doing very easy course. Okay, I shouldn't say very easy. No course can be easy. I'm sure architecture, law, engineering, everything has its challenges. But probably the amount of things that we have to literally mug up or spend time with the books or concepts we have to understand, in terms of hours in front of our books, it may be more than other courses compared to other courses which may be more practical oriented. And of course, when it comes to all your bachelor courses of like BBA, BCom और वो सब से, तो it's understood that you are spending more time studying. I think they will also admit it. So you feel very overwhelmed कि यार मैंने medicine enter कर लिया है. What I am trying to say is that the MBBS part is probably the easiest part of the journey that you have started.
Right.
Because if your internship is in a place where you are really going to be overworked, if your PG mein first 2 years, so you can't even imagine what's going to happen. Once you pass out, you think, oh wow, PG ho gaya, but then you realize that yaar mujhe itna kam aata hai compared to the others in my field. So then you go into fellowships, you go into setting up practices, you go into looking for hospital attachments, and then you go into trying to get famous in your area. So you're getting my point कि अगर आपको लगता है कि MBBS में first year, second year में आपका next 2-3 years are going to be tough, I am saying that that is the best time of your life.
Right.
So enjoy it like it's the best time of your life. अगर आपके कॉलेज के फेस्टिवल्स है, अगर आपके कॉलेज के आउटिंग्स है, अगर आपके कॉलेज के ट्रिप्स है, या कॉलेज में जो मस्ती होती है, यार प्लीज एंजॉय कर लो. आप इतना ठीक है यार. I know I can't say that PG prep in second year is not important because I have not done a PG prep in second year in my life, so I don't know if it is important or not. I don't know if there is data that these coaching classes have removed कि जो बंदा second year में चालू करता है उसको सीट को इतने chances है, जो बंदा final year में start करता है उसको सीट मिलने के इतने chances है. I don't know if there is data on that. होगा तो भी वो fabricated होगा क्योंकि they तो want you to start in first year, second year only the classes. So all I can say is that those may be the best years of your life, so you might as well enjoy them while you can. I'm not saying don't study or don't be serious, but enjoy them while you can. I'm sure you can figure out a way in which you give a couple of hours a day or an hour a day to MCQs and PG preparation, apart from your other textbook studies which you have to do to pass your theory and practical exams, because ultimately your foundation is also important. But yaar itna bhi mat karo ki you all are not enjoying your lives, because I don't know how much someone can. I can't imagine retaining something in first year for an exam 4 years later. मतलब मेरे दिमाग में तो वो comprehend नहीं होता है. I don't know if you guys have just inbuilt MCQs in your system from first year. तो I तो don't know.
Right.
So yeah, so that is one thing. यार, please enjoy your MBBS life. Secondly, from the academic point of view, obviously it can get very you can get very carried away in terms of your MCQ books and your MCQ tests and your 12-hour classes, that you start giving less importance to the clinical postings, you start giving less importance to your practical knowledge, because you know that your PG entrance exam is ultimately theory based and MCQ based.
Right.
There is no viva, there is no one coming to ask you questions, there is no skills that you have to demonstrate to get into a PG college, and nowadays that seems to be the only important factor. Like I remember हम जब 11th-12th में थे तो everything depended on तभी CET था, तभी NEET UG नहीं था, हमारा common entrance test था. So everything was on the common entrance test. No one cared about 11th-12th के मुझे HSC के उसमें पास होना है, क्या करना है उसमें, तो बस बेस मार्क्स लाने और खत्म करना है.
Right.
So it is not a situation like that over there. That is still valid कि तुम PCB कर लो और तुम अपना मेडिकल कॉलेज ले लो. HSC में तुम्हें जो भी दूसरे सब्जेक्ट्स में 60 आया 65 आया कोई फर्क नहीं पड़ता है. In this case, it is not the same thing because your clinical skills are also important.
Right.
Not only do you have to genuinely pass your practical exams in your UG institute, but the kind of things that you will learn in the practicals, even I know deep down that how much biochemistry I remember, I don't know. How much microbio I remember and I'm using in today's life, I don't know. It's practically not important for my field, at least in orthopedics. But there will always be subjects that you feel are not important in life and things like that. But the basic, तुम्हारे जो मेडिकल के क्लिनिकल पोस्टिंग्स होते हैं, तुम्हारे जो सर्जरी के क्लिनिकल पोस्टिंग्स होते हैं, तुम्हारे जो OBGYN के होते हैं, these are absolute basic things which are needed in general in life, not just for passing that practical exam. So don't be so involved into the MCQ journey and the PG prep journey, which I know is important because your future depends on it. But clinically also being sound is very, very important. So that is something you need to focus on also, apart from actually reading your general textbooks that are required to pass your theory exams, because ultimately your MCQ knowledge, your base is strong, obviously it'll help you in your MCQ knowledge also. So these are the 2 points that I can think of from the academic side. And in general, enjoying life, don't neglect your friendships, don't neglect your relationships, don't neglect your families. These things are also very, very important. Everything isn't about your books, so please live as regular a life as possible. अगर आप इतना दिमाग पे बोझ लेके बैठोगे कि ओ माय गॉड मैं MBBS स्टूडेंट हूँ, मेरा लाइफ अलग है, ये है, तो फिर हो जाएगा. इतना कुछ नहीं होता है. You can find time for recreation, you can find for hobbies and passions, you can find time for your friends and your outings, and all the other things also, and you can study happily, and do well in your studies also. So please tell yourself that you are a regular student, you are living a regular life, and you will realize that there is time for other aspects as well.
Right. So perfect. So I think this is what was needed out of this session. I hope that everyone, I think there are many advices which you should incorporate in your day-to-day life. And always remember, this is just the start. MBBS is, like sir said, is the easiest part of all. And you need to have a balance in your life so that you can always, whenever you look back, you don't have any regrets. So that's the takeaway message from this session. Thank you so much, sir, for all of your time. And I would request everyone to, go and check out sir's page if you haven't yet. And awesome content, awesome, something which every medical fraternity person is proud of the content. And that's what is needed at this stage. Thank you so much, sir, for your time.
Thanks a lot, Akshat, for having me. It was great fun.
Yes, sir. Thank you so much, sir.
Okay, see you.